sponsoring this, supporting this summit. And please, Alex, before starting your presentation, could you please shortly present yourself? Thank you.
Of course. Thanks, Alex. Thank you very much for the introduction, and thanks and good morning to everyone. Good afternoon, wherever you're listening. So let me briefly introduce myself. So as you can see from my slide on screen, I'm Senior Director, Client Partnerships at Within3. I've been at Within3 for just about 18 months now. So I joined the company prior to the pandemic starting. So it's been an interesting last 18 months or so. We've all lived through interesting times, as they say. Prior to joining Within3, my background is 30 plus years in pharma. So I started off in-house in sales, marketing, sales management roles. And then I moved into the agency side, where I've had a number of different leadership roles in global medcoms. And really this sort of thread through my career has really been digital, education, and meetings, which obviously sort of roll into what I'm about to talk about at Within3. So this morning, really what I want to talk about is really how to actually accomplish more with fewer meetings. I think obviously during the pandemic, we've all probably missed having that one-to-one live interaction, and we've become very much used to sort of digital engagement and actually spending lots of time on video calls, etc. So what I want to do today is just, as I say, talk a little bit more about what Within3 do. I want to talk a little bit more about what we're seeing, and that's the fact that actually medical affairs teams are actually not only keeping the digital programs, they're actually expanding them and actually increasing those in their strategies post-COVID. And really what I really want to focus on today is the difference between what a virtual meeting is and also virtual work, because actually the two are very different and don't necessarily go hand in hand. So what I'd like to do is just kick off with a little bit of background in terms of who Within3 are, for those that don't know the company. So Within3 are basically a software company, and we only work in healthcare and life sciences. And basically what we've done is we've developed a communication platform which allows people to communicate with all of their key groups. So be that healthcare professionals, be that patients, and basically we've been doing that now for over 14 years. We work with all of the top 20 pharma companies and many of the mid-sized pharma, biotech, and also device companies as well. And I think the key thing here is that it will allow you to communicate sustainably, flexibly, and with any audience that are key in terms of your communication strategy. So as I say, the platform was designed with life science industry in mind. And what that means is basically it's incredibly secure. We have a number of built-in compliance features. So that means that many of our clients actually trust the platform with their most confidential information as well. What I would say is that the platform obviously is, as I say, unique, built entirely for pharma. And what it does do is allow you to create new and efficient work stream for your organization. And again, I'm going to look at some case studies a little later as well. So in terms of the platform itself, for anyone who has not actually seen it, it's incredibly simple and straightforward to use. Anyone who's used any form of social media, be that professional such as LinkedIn or personal such as Facebook, will be very familiar with this sort of threaded conversation. And basically, the platform is designed to be asynchronous. And what that means is that basically your users will be able to access that information anytime, 24 hours a day, 7 days a week. And it was interesting, Gareth was talking earlier about his EMBA and the fact that the platform that he used for that allowed him to access chunks of information on his mobile phone in handy 6-minute sized chunks. And again, the Within3 virtual engagement platform is basically able to be used on any internet-enabled device, so you can use it on a mobile phone, be that Android or Apple. You can use it on desktop computer, be that PC or Mac, or on any tablet device as well. So as I say, it allows you to communicate with your users anytime, anywhere. And again, we are working globally. So we had some conversation about China earlier, and we are working with people in China and Russia. So again, access is not an issue. In terms of the company, again, for those that don't know who Within3 are, we are headquartered in the USA, but we are a global company, as you can see here. So what that means and the benefit of that for you and for your target groups is that basically we can provide you with support in the right time zone, but also probably more importantly, in the right language as well. And in fact, on the left of the screen here, you can see these are the languages that we can support an end-to-end engagement. So again, we can provide all of the training and support, which goes along with the use of the platform in any of these languages. And as I say, we're also available 24/7 globally as well. And as I say, we will initiate sessions in any of these languages. And again, as I say, support you throughout, because it's not just the software we provide, it's also the associated service as well. Now, many of you may have thought about the use of platform, and probably you think about it probably as a platform for global and local virtual advisory boards. What I wanted to show you was that actually the platform has many applications beyond the virtual advisory board. And this is actually anonymized data from one of our clients, just to show the mix of how the platform is actually used. And as you can see, obviously virtual advisory boards are quite a large percentage of the usage, but it's also getting used for many other things such as publication planning, payer and access pricing, patient education, and also we're getting used for things like Congress huddles as well, whereby obviously in the new world, as we emerge from COVID, not everyone's going to be able to attend congresses, but obviously there's lots of very useful information. So again, it's just another way of actually providing access, perhaps to people who cannot otherwise attend that meeting as well. So the platform has utility and use way beyond the virtual advisory board. So again, moving on and coming back to the world that we all live in, whilst I'm not a medical affairs specialist by background, obviously we work a great deal with med affairs groups in many, many different companies. And on screen at the moment, you can see this was a poll basically from a Reuters event, which was held back in March. And basically, this was a poll for over 1,200 medical affairs specialists. And basically, they were asked to predict what the biggest change in medical affairs will be over the next 5 years. And interestingly, I think the things that came back, you can see that everyone thought that there was going to be more customer engagement. And again, one of our speakers earlier was talking about the fact that obviously medical affairs is now probably the prominent channel in terms of pharma communication to its target groups and to its customers. Bigger share of voice for medical affairs, and a shift from face-to-face to hybrid, and also that becoming more data-driven, which I think is probably something that you're all experiencing in your own companies as well. And I think we wanted then to just look at that balance of remote versus face-to-face, because obviously the world is starting to come out from the COVID pandemic with the rollout of vaccination, etc. So does that automatically mean that people are going to go back to having live face-to-face meetings? So that was the question. What were this group, what was their opinion in terms of what was likely to happen post-COVID? So you can see here that the majority thought that actually there'd be some face-to-face, obviously, but the majority of interaction would still be remote. Some felt that there would be some remote, but the majority would be back to face-to-face. And then there was a few people who thought that there would be no face-to-face or no remote at all. However, I think, with the theme for this conference today, I think, what's been the most positive development of the pandemic, and I think that's basically that pharma has actually changed its attitude towards digital, and actually it's now digital, which is seen as probably being the prominent and predominant approach to communication. And that's also being reflected, I think, not just within pharma, but in many different other industry areas as well. And again, Bill Gates is often quoted, and again, this was a quote that he actually said, I think, at the back end of last year. And he basically said that coronavirus will fundamentally alter the way people travel for and the way they conduct business, even after the pandemic is over. And he basically feels that over 50% of business travel and 30% of days in the office would basically disappear. And I think, interestingly, talking to our clients, what we're finding is that, again, many groups are saying that they will fundamentally probably travel less. And that basically the threshold for business travel and trips will be higher. And obviously that people will continue to work remotely. There will be some days in the office, but they will continue to work a few or many days remotely. And as I say, it's not just in the pharma industry. Other sectors such as banking, Hong Kong Shanghai Bank, basically they've also said that they're going to reduce the number of business trips. And even the chief exec says that his own travel will actually be cut in half. So that obviously is quite dramatic for that industry as well. So as we come out of COVID, and again, I can speak to this myself, having spent the last 12 months conducting meetings by looking at the small screen every day. I think we're all finding that we've all experienced that Zoom fatigue and that lack of energy. It's actually very difficult engaging people on a small screen. It's actually easier to do that face-to-face. So it's been quite challenging for us, and people have been working obviously in their home office. People have been caring for family members. And with all that chaos and uncertainty, many organizations have actually gravitated to online working. And in fact, the MSL Society basically found that during this period, access to your key opinion leaders, and again, this was spoken about earlier, has actually been reduced by over 50% during the pandemic. It's actually been much harder. Many of them have been very busy working obviously with the pandemic, and just obviously access has been very difficult, full stop. However, what's been really interesting is the fact that actually KOLs now are actually being much more receptive to interactions being online and actually accessed that way. And what we're seeing now is the rise of the digital opinion leader rather than the key opinion leader. So again, quite a change in our industry. So I've spoken about travel, and again, prior to the pandemic, one of the things that our clients were actually starting to consider was their carbon footprint. So not only obviously is travel difficult at this moment in time, but I think as we escape from the pandemic, one of the benefits of the pandemic was the fact that everyone was aware of the reduction in CO2. And again, I think that's something which many companies may start to take into consideration again, post-pandemic, is what's their carbon footprint. And again, that may also have an impact in travel as well. Also, I think when we talk about virtual participation in meetings, it actually provides a fairer model as well, because actually it's much, much easier for people to participate in a virtual meeting than having to actually travel, especially when we think about groups such as patients. And I think access to patients via virtual meeting models is probably much greater, and perhaps has many, many benefits for that group as well. So hybrid meetings is really what I wanted to talk about today, and basically the ability to actually offer the best of in-person meetings and virtual meetings. So we'll talk about hybrid engagement, and I think this is something which many of you may have experienced over the last 12 months or so. If we think about the different ways we can actually engage with our key and target groups, obviously, prior to the pandemic, and as I say, now starting to reappear again, is that obviously that real-time engagement, in-person live meetings, which I think obviously is now starting to reappear. However, as I say, what we've been doing over the last 12 months is real-time engagement, but via virtual meetings as well. So as we're doing this morning, we were meeting via Zoom or other web-enabled communication mediums. And that virtual engagement obviously has been the mainstay. And during the early part of the pandemic, we talked about Zoom fatigue, and many of our clients basically took their live face-to-face meetings, transferred them into basically a 4 or 5 hour Zoom meeting. And needless to say, the end result was probably less than satisfying. So that's really where the asynchronous overtime platforms such as Within3 come in. And basically, that will allow you to engage with your audience, to get involved in discussions, but it's done at a time that's convenient to your audience. So as I say, it's available 24/7 on any device. And what we're starting to see now is actually, as we coming out of the pandemic, not that teams are now starting to think that actually they're going to just go back and have just real-time meetings. But what they're actually doing is starting to think about how they're actually going to use asynchronous meetings to actually get the best out of their live meetings. And that's where this hybrid model comes in. So basically get a lot of the pre-work done on the asynchronous overtime platform. And then basically that will allow that face-to-face meeting to be much more productive. So what does that look like in reality? So as I say, today we're having our live webcast. And again, as I say, many companies now realize that actually 3, 4, or 5 hour Zoom meetings are not the most productive way to do that. So at Within3, our recommendation is basically the live sort of virtual meeting should be no more than 2 hours. And this is how we would see a typical session being structured. So perhaps have that kickoff meeting with the live sort of virtual meeting where everyone can actually meet. You can introduce the expectations and what the session is going to be about. Then basically using the platform, you would have that insights and discussion, which is a moderated discussion. And it's also, as I say, when it's convenient for your participants to participate. And the platform can be open for any period of time, but in this case, we're showing that after 10 days, we're going to have another live webcast, and we'll actually update everyone on progress, what the next steps are, and then basically post that, we'll then have the final deliverables, what be that consensus document or publication strategy or whatever the session was about. And then basically at the end of that, we would have a results call with the client. So that's one typical model of how a hybrid meeting could run. But as I say, it's incredibly flexible. And as I say, this will also work with live meetings as well as live virtual meetings. So in this case, as I say, what you might want to do is actually use the platform for pre-reads. Again, many of our clients do this. So you would have the pre-reads and pre-work done before you have your live meeting, be that live virtual or live face-to-face. In this case, we're showing it again as another webcast. Then back into the platform again for the overtime discussion before again having our final check-in and final webcast before again the final deliverable is completed, and again the session closes. So as I say, the programs can be structured in many, many different ways. Now, I wanted to talk earlier about the difference between a virtual meeting and virtual working, and what's the difference. And I think this is one of the key things with regard to the use of the asynchronous platform. So again, back in my days in Medcoms, where we'd organize an advisory board, obviously a great deal of time and effort went into developing the program. We would be very meticulous in terms of who we want to invite to the meeting, who the chairperson was. We'd go and do the site visit for the venue, et cetera, and eventually we get everyone to the venue for the day's advisory board. And here you can see in this particular model, we have all of our different advisors here. Now, obviously in a live face-to-face meeting, it's not possible for everyone to contribute at the same time. So what does that mean? Well, it basically means that whilst you are paying for everyone's time, you're not actually getting the same amount of value. And asynchronous actually gives everyone an equal voice. So again, the other thing during that live advisory board is quite often, the conversation will be dominated by a particular individual. And again, that's where the chairperson was critical in terms of making sure the meeting kept to schedule, kept on topic, etc. But here, as I say, everyone has the equal opportunity to speak, and that then is basically recorded in the transcript, and then can become an actionable insight at the end of the meeting. So what's the benefit of overtime? As I say, it's much more inclusive for everyone. And in terms of during that COVID period, what we found is that this was something which everyone really appreciated. Basically, people could actually contribute at a time that's convenient to them. It allows people time. I think the thing you will also find is that the output from the asynchronous or overtime meeting is probably richer and deeper because people have the luxury of time to consider their response. The other thing that's also really important is the platform from a language point of view. The platform can simultaneously translate into 120 different languages. And as I showed you on the previous slides, we can also support sessions in a number of different languages as well. So again, it's very, very inclusive from that point of view. The platform also includes a number of different tools which allow collaboration, co-authoring of documents. And again, we find teams use that internally, but also externally with their experts as well. And as I also spoke about, there's a high level of compliance and data protection built in as well. So the platform itself has some added benefits as well. But I think for me, this is probably the key one. Now, as I say, let's assume we've got 10 advisors, we've got a 3-hour webinar, and basically, obviously, from a fair market value point of view, you've decided that you're going to pay a certain amount for their honorarium for participation. So we've got 10 people, we've got a 3-hour webinar, and obviously, as you can see from the diagram in the center there, that then creates a problem because we have obviously a funnel effectively. So we've potentially got 30 hours of input from our advisors, but we can only get a maximum of 3 hours out because obviously we only have a 3-hour meeting. So in reality, what does this mean? It means that actually we've wasted 27 hours of people's time. The productivity level is only 90%, and we've actually wasted 90% of the potential of our meeting. Not to mention a lot of honorarium and also a lot of our stakeholders' time, which again, we haven't used effectively. So again, when you're thinking about that live engagement, as I say, is it actually the most effective? Does it give everyone the equal share of voice? Or potentially, would there be a different way that you can do that? So getting towards the end of my presentation now, and I just wanted to, before I open up to questions, just talk about a case study. So this was a European medical affairs group, and this was an advisory board in oncology. And basically, the objectives were basically that the team wanted to gather first impressions of survival data in a study. They also wanted to understand the opinions from this group about the data related to a specific class of drugs. And also they wanted to talk about different patient treatment strategies and also obtain their oncologist's personal experience with a particular therapy. So what did they do? Basically, the solution was that they used the Within3 platform to conduct a virtual meeting with a second group of oncologists. So they were going to have a face-to-face meeting, but they also wanted to engage with a second group, and they did that virtually. And basically, that allowed them to get 2 different groups of opinions. It allowed them also to engage with a second group very, very quickly and rapidly. And the outcome was basically they were able to get more insights. And basically, even with that short lead time, all of the oncologists were able to participate because they weren't required to travel and they could contribute on their own schedule. And also, I think this is again, the benefit of the platform as well. Everything that's recorded on the platform is actually produced as a transcript. And that then is available to you literally throughout the engagement and also at the end as well. And it's obviously a much, much easier way of getting the output than actually having note-taking, etc., during the meeting as well. So before I get to the end, I just wanted to very quickly talk about the the benefits of virtual engagement. And I think the first of that is actually diversity. So by engaging people virtually, we can include people perhaps that we wouldn't normally engage in our meetings. And I think one of the questions is actually about, have we engaged in patients via the Within3 platform? And absolutely. It's absolutely perfect for engaging patients, and a lot of that gets done. With patients, obviously, a colleague of mine works for Novartis, and she's in charge of patient engagement. And after the first time she used the Within3 platform, she actually gave me a call and basically said, I'm never going to run a live face-to-face patient ad board ever again. And that's a real quote. So diversity inclusion is basically key when it comes to patients. We can absolutely do that. And also on the platform, we can also anonymize participants as well. So if it's really important, if there's some sensitive information and patients may feel that they don't want to share that, again, we can actually anonymize them as well. And as I talked about, they can also engage in their own language as well, because we have that wonderful ability to simultaneously translate into a number of different languages. So again, we don't need to have people translate for patients. They can actually participate in their own language. So again, very, very useful from that point of view. In terms of sustainability, I talked very briefly, basically about the fact that as we're emerging from the pandemic, travel may become an issue again, and basically the platform is incredibly sustainable. Obviously, no travel involved at all. So from that point of view, it has a positive impact. I think this is really important. And again, at the end of every session, we also basically ask all of our delegates, all our participants about their sort of impression of the platform, whether they found it useful, et cetera, et cetera. And again, this is one of the key things that comes out, is basically it allows them to basically interact, input, but at a time that actually works for them. So from that point of view, it really works from a work-life balance point of view. We always bring groups of people together that are very diverse, be that geographically or, as I say, perhaps groups that you may not necessarily bring together. So from a global connectivity point of view, the platform is certainly unique as well. And this whole thing about patient centricity, we've talked a lot about patient centricity as an industry for a long period of time. And this platform really does allow you to be patient centric. And in terms of in those discussions with our sort of medical affairs teams that we're working with, what they're basically playing back to us is obviously many of them are now in the planning sort of sessions for 2022, and obviously looking at what they're going to do in the second half of this year. There is very much a virtual hybrid focus. They are going to introduce real time, and that's predominantly being done still via webcast, but they are producing that hybrid model, so using the asynchronous platform, but with a live virtual element as well, to get the most of and the best impact from both. That real-time connection is really, really important. And also, as I say, teams are using the platform internally, and that's not just in med affairs, but also in commercial as well. So in terms of how to get the best out of your virtual engagement, basically what we would say is basically it's important for companies to really think about their own internal processes, and if they haven't done so already, to really include virtual as one of those key medium that they're going to use. You have to think about the contracts you have with your advisors. And many are now having, rather than just a single engagement, they're actually having contracts which allow them to engage a number of times over time. And again, that just allows you to be more flexible and to engage with people more rapidly at a time that's relevant, and to actually, as I say, engage over a significant period of time. We talked about digital thought leaders, and again, I think this is now a trend. We see people that perhaps would not have been considered as traditional key opinion leaders rising because of their adoption and use of digital media. So again, that's a very interesting and different paradigm. And having again worked in medcoms where over the years, we basically mapped key opinion leaders and looked at influence, etc. I think we're now seeing that there's a different paradigm here, and that's the digital opinion leader. So what I would say, final step from me is basically, when you are engaging, make sure that you partner with vendors and agencies who are experts in the technology. We don't produce content, so we always work with your content production agencies or yourselves as well. And basically use the tools to make sure you get the most out of your medical expertise and to maximize your engagement. And that really is the end of my formal presentation. So what I'd like to do now is basically see if there are any questions, and I'd be happy to take any questions from the floor. And back to you, Mr. Chairman.
Thank you very much, Alex, for your presentation. Very interesting. So indeed, the floor is open for questions. So happy to hear you. Please unmute yourself and have your questions. We have more or less 10 minutes. So yeah, I really, personally, I think virtual meetings are great, or hybrid meetings, especially you see now more and more HCPs from remote countries or developing countries like Africa or other regions that are now participating to meetings, to symposium, to ad boards, and this is really great because these countries usually don't have the possibility to come to Congress in Europe, or also some countries, because of regulatory reasons, cannot send HCPs. So I think opening up congresses by virtual way is really great. I think it will increase the audience, the interaction, etc. So absolutely. Any other comments or experiences or questions, please?
Hello, can you hear me? This is Yolana.
Hi, Yolana, yes.
Hey, Alex, thank you very much for your very nice overview. I pretty much can echo, your view that probably the hybrid will be the future, especially after pandemic, because what I just would like to share with you, I have been in the last 18 months engaging a lot with KOLs across my region, which is from Latin America to Middle East and North Africa, Turkey, Switzerland and Russia, and but also engaging speakers from US and from Europe. And I have some speakers who really told me, you know what, I am tired of this virtual world. I want to meet in person. Yeah. And this is actually, I mean, now I'm talking about the speaker's perspective. So I would say 90% of them want to meet their colleagues in person. So therefore my question would be, you showed us this survey output. Who was the people who have been asked for this? Because I think, in the previous presentation, we saw that, or the first presentation, we should be customer-centric, So we pretty much need to, somehow to see what all the, not just from our perspective, but also from the perspective of the speakers. But I also see what Alex said, that, some countries are happy for the virtual world because otherwise they couldn't travel or they didn't participate.
Yeah, Joanne, just to answer your question. So the survey was done with 1,200 medical affairs specialists, so people like on the audience today. So that was your peers. Basically, that was their opinion. And that was, as I say, back in March this year, so not that long ago. In terms of live face-to-face meetings, I mean, I think there's absolutely no doubt when people are able to do that, people want to go back to being able to do that. But will we do it as frequently? Will people travel as often as we did before? So what I think the model will become is, where perhaps we would have had, let's say we were going to have 3 advisory boards in a year with a group of advisors that we're working with, you might have one of those as a live face-to-face meeting and the other 2 as virtual meetings, because you then get the best of both. You have that live face-to-face meeting, everyone can sort of see and greet everyone, but then you don't want to necessarily travel as frequently as you did before, but you can then still get the work done asynchronously over time via the virtual engagement platform. So I think that's going to be more the model. So within 3, we certainly never say that live face-to-face meetings are bad. They're certainly not. There's a lot that you can do there that you cannot do virtually. But I think the interesting question is, what's going to be the balance? And again, that would be an interesting question to this group. Ask the same question. Will the medical affairs specialists that are here today, will you get rid of your virtual engagement and will you go back to purely face-to-face, or will it be a blend?
Yeah.
Thank you very much. Thank you.
Yeah, and we see same discussions on the chat. So from Irene or Eric or other colleagues here from medical affairs. So indeed, yeah, they express that live exchanges, face-to-face exchanges generate more spontaneous perspective and insights, and that HCPs are really craving for live interactions. I agree totally, but on the other hand, I think, yeah, virtual interactions offers also a lot of possibilities. So I think you have to see make a balance for yourself, see the positive and the negative aspects, and I think, yeah, of course, face-to-face interactions can be more richful, but I think now also the quality of virtual interactions is really increasing a lot. So you have a lot of tools. You have now a lot of within Zoom or Teams or other platforms, a lot of tools that help you to increase the interactions. You have tools like Mentimeter or polls that you can just do during a virtual interaction, and this maybe sometimes that you cannot do during a face-to-face. So yeah, you have to see it. It's a question of balance, but I'm sure the tone is set, and after COVID, we will continue to have hybrid virtual interactions more than before the pandemic. I'm totally convinced. Alex, do you agree?
Yeah, I mean, absolutely. I think there will be a blend going forward, absolutely. And I think initially, as I say, people are going to want that live interaction, but equally, as I say, I think there will be some reticence from people to travel. The pandemic is at different stages in different parts of the world, so it's going to be at least another 12 months before we probably are able to travel globally. Certainly within the US at the moment, I think things are already opening up because it's a large single country. The picture is very different across Europe and very different in the Far East and Asia as well. So it's going to be a blend, there's absolutely no doubt. As I say, I think that mix of live, virtual, asynchronous is going to be the tool of the future. And certainly with some groups such as patients, it may actually be the preferred choice, but ultimately, I think someone put in the text there, it needs to be about what is the correct channel. It's got to be tailored to your customers, which is the most appropriate channel for you to use. And there are just now more channels available.
Absolutely. So I see some discussions in the chat, but I would like also to hear you, to see you. So we are around 50 here, specialists in medical affairs. So please also express yourself, unmute yourself, open your camera. Again, we are 2 days together. This is really an opportunity to know each other. As I explained in the beginning, I'm really looking forward to know you better, because I'm with Bayer, and I only see my colleagues from Bayer. I only can interact with them. And this is really an opportunity to meet colleagues in medical affairs from other companies. So please, unmute yourself, express yourself, don't be shy, open your camera. We still have like a couple of minutes before the first break. So I see Mohammed, agree you're missing the enriched and intimate discussion on
hi, Alex.
and trust.
Hi, Mohammed.
Yes, hi, Mohammed. Good to see you.
I thought I'd take your advice and unmute myself and put my camera on. So
great, thank you.
So yes, I think what we're experiencing certainly is a sense of fatigue and apathy around online interaction, but I think also with the audience, right? Because if you have people that are not familiar with each other and they haven't had the opportunity to have a proper icebreaker in a much more natural setting, which would be through a face-to-face interaction, getting to know one another, maybe because they've met at different congresses over a period of time or in different types of meeting settings. And I think when we saw the within three pie chart as well, a lot of advisory boards taking place, and that seems to be the majority of the focus. But of course, then from a compliance perspective, you have to think about how many advisory boards are actually relevant. And I think ad boards online are allowing interactions because clinicians can dial in very easily and have that discussion. They often know each other already, or they get to meet people this way in short bursts, and then they don't need to move from their desk. They can, dial into the next one afterwards or go to see their clinic. But in terms of ongoing relationship building, it's certainly challenging to do more than ad boards. And I like the idea of bite-sized learning, but then if you take that into account with all the other tools that we're now having to use in our mobile phones, and starting to understand the psychological impact of using so many devices and your brain being constantly active or jumping between topics, how healthy that is in the longer term as well. And I think it's somehow potentially going to achieve burnout in individuals, especially even some of our top KEs that are certainly playing the circuit when it comes to interacting with companies. But it'll be interesting to see how, as we move back into some form of normality, the shift occurs between hybrid events, because I think there you also have the challenge of how you give equity between people that are online and people that are actively there face to face.
And I think that's going to be an interesting model going forward. Many of the major congresses now are looking at different models where they have obviously people who are able to attend live. They're going to have a virtual model, and they're even looking at different pricing depending on how you attend the conference, different content available. So the world that I've worked in for over 30 years is now going to be very, very different. And it's going to be interesting, as I say, where we settle in 12 months' time or so. But yeah, one thing for sure, we're not going back to exactly the same model we had before.
Okay, well, thanks a lot. I think we reached the break. So I'm asking Alan Lloyd, we have a break from 10:45 to 11:15. Is there something foreseen in the break?
Yes, can you hear me? Is it good?
Yes, we can hear you.
Wonderful. So regarding the breaks, yes, you are absolutely right, Alex. We are starting our breaks, and we are